Welcome to the deep dive. Today we're zeroing in on something really important, choosing the right healthcare facility here in India.
Yeah, it affects everyone.
Exactly. Whether it's, something minor or maybe more critical, making a good choice about where you go for care, well, it can make a huge difference to the outcome.
Absolutely. And to help you navigate that, we've really dug into quite a few resources.
Okay.
We're looking at info from the National Accreditation Board for Hospitals and Healthcare Providers, that's NADH, insights from SupremeMedic, a healthcare consultancy,
Right.
HospiMatch, which is a hospital services platform, specific points from Felix Hospital, and just some general guidance on picking healthcare spots.
So the mission today is pretty clear, right? We want to give you a good handle on the different kinds of facilities out there in India, highlight the really key things you need to think about when you're choosing one, and offer some practical steps. The aim is for you to feel, well, confident and ready when you need healthcare.
Sounds good. Let's get into it.
Okay, let's start with the big picture. What does the healthcare landscape actually look like?
So, based on what we've looked at, there are several main types. First up, you have clinics.
Like your local GP.
Exactly. Could be a solo doctor, maybe a group practice. They focus on general consults, maybe minor treatments, good first stop for, common colds, initial checks, that kind of thing.
Got it. Then what?
Then you've got polyclinics. These are usually a bit bigger.
Okay.
Multi-specialty, often outpatient only. So you might find several different specialists, basic lab tests, maybe physiotherapy.
So potentially good for, ongoing family care or managing chronic conditions.
Precisely. Moving up a bit in scale, you find nursing homes and small hospitals.
Right.
These are more medium-sized. They'll have inpatient beds, can often handle minor surgeries. Think maybe maternity care, general inpatient stuff that's not super complex.
Okay, makes sense. And then the big ones.
Yeah, and then you get to the multi-specialty and super specialty hospitals. These are the big players. They have the advanced infrastructure for really complex conditions, emergencies, treatments like cancer care, organ transplants. SupremeMedics even mentioned names like AAMS, Medanta, Apollo, Fortis as examples here.
Okay, AI, Medanta, those are definitely well-known names.
And something else that came up is the government versus private distinction.
Ah, yes, that's always a factor.
It really is. Government hospitals are often much more affordable, sometimes free, which is obviously huge for many people.
Definitely.
But on the other hand, private hospitals usually mean faster access, maybe better amenities.
So a trade-off.
Yeah, a definite trade-off. Cost versus speed, and perhaps comfort.
SupremeMedic pointed out that while government places win on affordability, the private sector often invests more in the latest tech.
Which could impact diagnosis or treatment for tricky cases.
Potentially, yes. Understanding that balance based on your specific situation is, it's key.
Okay, that gives us a good lay of the land. Now let's say I need to choose one. What are the absolute must-consider factors? Okay, several things really stand out from the research. First off, location and accessibility. Seems obvious, but...
But critical, especially in an emergency.
Exactly. You want something close by, easy to get to. Think about ambulance access, public transport links too, especially for ongoing care.
Good point. Dealing with travel headaches is the last thing you need when you're unwell. What else is high on the list?
Doctor and staff credentials. This is non-negotiable, really.
You need to trust the people treating you.
Absolutely. Look for their qualifications, MBBS, MD, DM, things like that. Yeah. And experience counts. Also, and this came up repeatedly, NADH accreditation.
Okay, tell me more about that. Why is it so important?
Well, NADH is the National Accreditation Board. It's a quality certification. If a hospital has it, it means they've met pretty strict standards for patient safety, care quality, infection control.
So it's like a seal of approval, a quality check.
Sort of, yeah. It's a really good indicator that they're following established best practices. Felix Hospital highlighted it. General guides mention it. It's a consistent theme.
Okay, NABH accreditation noted.
Right.
What about the place itself, the building, the equipment?
Facility infrastructure, hugely important. Is it clean, well-maintained?
Basic, but essential.
Right. And does it have the right equipment, modern, working properly? If you might need critical care, you need to know if they have an ICU, ventilators, dialysis, The right imaging tools?
Depending on your needs, yeah, you have to ensure they can actually provide the care required.
Exactly. And linked to that is emergency readiness.
Yes, 204/7 availability.
Crucial, particularly for hospitals. Knowing they have round-the-clock emergency services, doctors actually in the hospital. Felix Hospital really emphasized this with their focus on emergency and trauma. It gives you peace of mind.
Definitely. Okay, and then there's the elephant in the room, cost.
Always. Cost and insurance.
Mm-hmm.
You need to ask up front about charges, consultations, tests, admission fees, surgery costs. Get clarity.
And check if they take your insurance.
Absolutely critical. Verify if your insurance policy or your TPA, the third-party administrator that often handles the claim side, is accepted there.
Yeah.
Suprematics also had a good point about using your insurance smartly, especially in bigger hospitals.
Right. Not just if they take it, but how best to use it. Good advice. How do we get a sense of, how good they actually are? Patient experiences.
Yeah. Patient reviews and word of mouth are valuable. Ask people you trust, family, friends.
Okay.
And check online platforms. Things like Practo, Google Reviews. They can give you a broader picture, though you always take online reviews with a grain of salt, right?
True, but still helpful. Anything else fundamental?
Specialized expertise. If you have a specific condition, say a heart problem or a neurological issue, you want a hospital known for that.
Makes sense. Go where the experts are for your specific problem.
Exactly. General guides stress this. Felix Hospital lists their specialties. It's about matching the need to the expertise. And again, accreditation like NABH reinforces that quality commitment.
It keeps coming back to that.
It does. Plus, just ensuring they have the necessary overall infrastructure and tech, and maybe looking at amenities like an in-house pharmacy or support services like dietitians, those practical things matter too.
Okay, that's a really solid checklist. Now let's zoom in on those really stressful moments, emergencies. How do we choose them?
Right, critical situations.
Yeah.
The Felix Hospital info was really insightful here. They stressed that the hospital choice in an emergency can genuinely impact the outcome.
High stakes.
Very high. And it helps to know the difference between general emergency care, like for a sudden severe illness, and trauma care.
Trauma being more about physical injuries from accidents.
Exactly. Like a car crash, a serious fall. It requires a specific type of setup.
Okay, so in those moments, what are the absolute must-haves?
Location and access become even more vital. Every second counts.
No time to waste.
None. Accreditation, like NABH, is still a key sign of quality standards even for the ER. And the emergency department itself needs to be properly equipped. Advanced diagnostics, enough skilled staff, doctors, nurses, specialists ready to go.
What about those trauma level things, level I and level 2?
Yeah, that's important for trauma care. Level I centers offer the highest, most comprehensive care for severe injuries, usually with surgeons in-house 24/7.
Okay.
Levels go down from there, maybe stabilizing patients before transfer. So knowing the trauma level designation of a nearby hospital can be critical depending on the injury's severity.
Wow, okay. That level system is definitely something to be aware of.
Absolutely. And just like before, specialization matters in emergencies too.
Mm-hmm.
Heart attack, you need strong cardiology.
Mm-hmm.
Head injury, neurology.
Right.
Felix mentioned their own strengths in cardiology, neurology, orthopedics, pediatric emergencies. Looking into patient outcomes or reviews specifically for emergency care can help too. And yes, even in an emergency, sorting out the insurance coverage quickly is still important.
Gosh, trying to think about insurance in a crisis? Stressful.
It is, which is why knowing beforehand helps. Also, think about support for the family.
Good point. It's not just the patient going through it.
Not at all. Good hospitals often have social workers, maybe counselors available during emergencies. And preparation makes a difference.
How so? What can you do beforehand?
Know your family's medical history, allergies, medications. Research hospitals near you. What are their emergency capabilities? Have a family plan. Who to call, how to get there. Maybe know where the nearest urgent care is for things that are serious, but maybe not life-threatening.
So proactive planning can really help when things go wrong.
Immensely. Know the local emergency number 108 for ambulances is key. And when you're in that critical moment, making a choice. Trust your gut feeling. Ask questions if you can. Consider how close specialized care is if needed. Felix mentioned their team lead, Dr. Salil Malik, as an example of that dedicated expertise you might look for.
That's incredibly helpful advice for what can be a terrifying situation. Okay, let's pull back a bit to general choices again. What are the practical steps and maybe some red flags to watch out for?
Okay, practical steps. First, really define what you need. What's the health issue?
Right, start with the why.
Exactly. Then research and compare. Use online tools, get doctor recommendations, check those reviews. Always look for accreditation NABH again.
Location, accessibility.
Yep. Check the reputation, evaluate the costs and insurance situation, see what amenities they have. Then weigh it all up and make your decision.
It sounds methodical. Makes sense. What about things that should make you wary? Red flags.
Definitely watch out for recommendations for lots of tests or surgeries that don't seem clearly justified. Ask questions.
Good advice.
Poor hygiene is a major red flag.
Yeah.
Untrained-looking staff, lack of clear communication from the doctors or nurses. That's worrying.
Yeah.
And big delays in getting diagnosed or treated that seem due to inefficiency.
Those all sound like serious warning signs. Now, Supremedic had that simple framework too, didn't they?
They did, and it's quite useful, basically. Yeah. Clinics for minor stuff, general hospitals for specialist consults, diagnostics, super specialty hospitals for the really advanced, complex, or referred cases.
Simple hierarchy.
Pretty much. And they linked it to cost and convenience again. Clinics are usually cheapest and fastest. Hospitals are a balance. Super specialty places cost more, might take longer to get into unless it's an emergency.
And use insurance wisely there.
Absolutely. Their big message was, choose based on your actual medical need, not just because a hospital has a big name or because you're panicked.
Makes sense. Need over brand.
Right. And the reminder, in an emergency, dial 108, have your medical info ready. Basic, but vital.
Okay, that brings it all together nicely. So just to quickly recap. We've looked at the different types of facilities in India, from clinics right up to super specialty hospitals. We've gone through the crucial things to consider: location, doctors' credentials, that all-important NABH accreditation cost, insurance, specialized expertise.
Yeah, a whole checklist.
And we really dove into emergency situations, the difference between emergency and trauma care, the importance of preparation, trauma levels, specialized teams.
Very crucial stuff for critical moments.
Hopefully this gives you, our listener, a much clearer picture and more confidence when you need to make these healthcare choices.
Absolutely. The goal is empowerment. Use this information, do some research about options near you. Knowing what to look for is really the first step to taking control of your health journey.
So here's a final thought to leave you with. Now that you have a better grasp of the Indian healthcare system, how might this change how you approach your own health or your family's? How might it empower you to be more proactive? And what other questions do you still have about making these choices?
Good questions to reflect on. And if you want to dig deeper, check out resources like the NABH website, that's nabh.co, or practo.com. They're great starting points.
Excellent. Thanks for taking this deep dive with us today.